They work on their dreams with focus and are prepared to take calculated risk and do not get deterred by failures as they move towards their dreams. Then they step up their dreams as they tend to reach the original targets. They strive to work to their potential. In the process, they increase their performance, thereby multiplying further their potential. This is an unending life cycle phenomena, culture of excellence. They are not in competition with anyone else but themselves. That is a culture of excellence. I am sure each one of you will aspire to become a unique with culture of excellence. I learned every youth wants to be unique. Every youth wants to be unique. That is you. Every youth wants to be unique. That is you. But the world around you is doing its best day and night to make you just everybody else. Question is whether you want to be you or everybody else. Being like everybody else is convenient at the first glance but not satisfying in the long vision. The challenge, therefore, my young friends, is that you have to fight the hardest battle. You have to fight the hardest battle which any human being can ever imagine to fight, and never stop fighting until you arrive at your destined place. That is the unique you. To get the unique you, it's a big battle. The battle means you don't need to take a gun. The battle means you have to have 4 unique things. 4 unique tools you must have in that battle. One is you have to set the goal. The second one is acquire the knowledge continuously. And third one, it's a hard work with the devotion. And fourth is perseverance. Where there is righteousness in the heart, there is beauty in the character. When there is beauty in the character, there is harmony in the home. When there is harmony in the home, there is an order in the nation. When there is order in the nation, there is peace in the world. Question is whether you want to be you or everybody else.
So we will introspect ourselves whether we want to be us or everybody. Okay, with this small video, let me move to my duty of welcoming the eminent personalities of this program. This program is being presided over by Dr. P. Jaishankar, Professor of Pharmacy, Medical College, Calicut, and the President of Indian Pharmaceutical Association. Jaishankar sir is instrumental in organizing and charting out this program for you people. So on behalf of all of you, I wholeheartedly welcome Jaishankar sir to this program. We have the chief guest for the program is Sri Ajitan, Director of Marketing, HLL Lifecare Limited. Ajit sir is a seasoned marketing professional with more than 35 years in marketing field. I would say that with this continuous improvement and continual improvement program, by developing his skill, has grown to the helm of affairs of HLL as one of the directors of HLL Lifecare Limited in a span of 25 years. So he is the right person to give us the keynote address for this day. I welcome Ajit sir to this function. We have the guest of honor for the day, Dr. Jose K. Thomas. He is a former clinical pharmacist, University Hospital, New York City. Dr. Jose K. Thomas is presently running Brooklyn SJ Pharmacy Corporation in Brooklyn, New York, which is a firm of his own. He has done his B.Pharm and M.Pharm from India, from Pharmacy College, Calicut, and Manipal Institute. So yes, MS and PharmD from University, Florida, USA. He has more than 40 years of experience in clinical pharmacology and clinical pharmacies. He is a member of the Pharmaceutical Society of New York and American Pharmaceutical Association. He has more than 40 years of experience in clinical pharmacy. We are honored to have you here today and eager to hear from you on the topic pharmacy practice, US scenario, and how and when we could achieve the US standard here. On all of you, I welcome sir to this program. There is no mention for Sri M.P. Josar. M.P. Josar is known to each and every pharmacist in our pharmacy outlets. So M.P. Josar is a program director for this program, Good Pharmacy Practice program, which is being conducted today. And we are continuing with such type of program. it is very difficult to cope with the pace of MB Joseph. He usually asks me, do this quickly. So it is very difficult to cope with this pace of MB Joseph. He's a multi-talented person. He writes very good literature. I used to read every morning when he shares in the WhatsApp. So he is an asset for IPA also. I welcome MB Joseph also for this program. We have the professional message on professional development program delivered by none other than Sri Benny Joseph, Vice President Retail Pharmacy Division and the Group at Pharma. The specialty of Benny Joseph sir is he puts his hands and eyes on every aspect of the business. That only has contributed to the success of this retail business. Now the retail business division is contributing more than 50% of the turnover of HLL Lifecare Limited. So this is because of the hard work and perseverance of Sri Benny Joseph sir as a leader. So he is the right person to give a professional message on professional development program. So I welcome Sri Benny Joseph sir to this program on behalf of all of you and my personal. Second professional message will be delivered by Dr. John Joseph sir, Professor Emeritus, Nisi College of Pharmacy, Ernakulam, and the Honorable Secretary, IPA, Kerala State Branch. I welcome John Joseph sir also to this program. The audio introductions will be done by Manju ma'am, Professor of Pharmacy Practice, College of Pharmaceutical Sciences, Government Medical College, Kozhikode. I welcome Manju ma'am. Orientation on rules and the assessment method will be done by Dr. Sujay Abraham, Professor and HOD Pharmacy Practice, Nirmala College of Pharmacy, Moattura. She is an ex-employee of HLL also. I welcome Sujay ma'am. The criteria for CPD points and the merit certificate will be delivered by Dr. Manjula Devi madam, Professor of Pharmacy Practice, Sri Ramakrishna Institute of Pharmaceutical Sciences, Coimbatore. Manju ma'am, I welcome you to this program. I have my colleagues Susha S. Nair, Senior Manager HR, and Arya Krishna. She will be delivering the vote of thanks today. Arya is coordinating the entire program without giving any job for me. That is how I should tell like this. Okay, so I welcome Arya also. Jenny ma'am for the Master of Ceremony. Welcome Jenny ma'am. She is the Professor of Pharmacy Practice, St. Joseph's College of Pharmacy, Charthala. Last not but the least, the 96 participants for this program from throughout the country. This program is for you. You should own this program. And each program, my advice is that you should not miss even a single class. All should be present for 15 modules. Do the pre-test, post-test, everything. Do well. And I welcome all of you to this program and wish you all a happy and fruitful learning. Thank you. Thank you all. Over to Jenny ma'am.
Thank you, sir, for those warm words of welcome and for the inspiring video that you shared. A good leader has the capacity to translate vision to reality. It's my privilege to invite Dr. P. Jayashekhar, President, IPA Kerala State Branch and former Professor of Pharmacy, Government Medical College, Kozhikode, for the presidential address. Over to you, sir.
Thank you, Dr. Jenny Samuel. Good afternoon to everybody. I'm much delighted. Chief guest of the day, Dr. Sri Ajit, Director Marketing, HLL Life Care, Trivandrum. Guest of honor, Dr. Joske Thomas, Clinical Pharmacist from New York, my classmate also. Sri Benny Joseph, Vice President, HLL. Sri Thomas Abraham, Deputy Vice President. Mr. M.B. George, former Trust Controller, Vice President of IPA, and also my classmate. Dr. John Joseph, Honorary Secretary IPA, and also Professor Emeritus, Lisi College of Pharmacy. Today's faculty members, and also we are much honored to have the presence of Dr. Ramesh Adupu, National Vice President of IPA India, and he is a principal, and he will be taking the first module next week on a good pharmacy practice and PPR. I'm very, very happy that he has joined this session and orientation. And dedicated faculty members of orientation team. There are 15 faculty members and 10 coordinators are there. And today we have a presence of Professor Manju CS, Professor Manjula Devi, and presence of Suja Abraham to take an orientation program. And we are much happy to associate with Srimadi Arya Krishnan, National Manager, much dedicated for the PDP program, and all the faculty members, and much awaited, dedicated HLL Life Care Amrit Pharmacy participants. Really, this program is for you. Warm greetings on behalf of this, and we are IPS much indebted to management of HLL, especially Dr. Anita Thambi, Chairman and Managing Director of HLL, Trivandrum, visionary leadership, and her interest and commitment to transform HLL Amrit Pharmacy to Center of Excellence in Pharmaceutical Care is a landmark event. And I had a discussion with her. She is much passionate to develop Amrit Pharmacy to centers of excellence of public need. With utmost humility and proud privilege, the IPA Kerala State Branch is administering the PDP on good pharmacy practice for the second batch of dedicated pharmacists of HLL Amrit. We could successfully train about 90 pharmacists the last batch, and we have observed that the enthusiasm, the spirit of pharmacists of Amrit Pharmacy of HLL in the last conclave, which was conducted in Volhati Palace, Cochin. The much interest, the pharmacists are much interested, they're motivated. I'm very sure that such motivation will help to reach further heights. In tune with the provisions of Pharmacy Practice Regulation 2015, the patient counseling service is very, very important, and we have to strengthen it in all pharmacy settings. Dear participants, friends, such service would bring the pharmacists close to the patients and get recognized as important healthcare professionals. Effective patient counseling will enhance patient compliance to medication. We can safeguard the public health by educating them about the proper use of medicines, precautions, side effects, ADR, contraindication, drug interaction, storage condition. Overall, farmers can be a health educator, and you can advise them to prevent diseases, especially preventing the vaccinations. Therefore, farmers shall be responsible. We have a responsible role in as a frontline health professionals. Effective patient counseling to enhance patients' compliance. And also we have a responsibility to have a rational use of medicines, to advocate the use of generic medicines, curtail misuse of medicines, and prevent improper uses, especially antibiotics, so that we can curtail the AMR. But see, that we have been educated, we have been trained, we have been empowered, but still there are a lot of barriers for pharmacy professions. Still, pharmacists could not gain professional status in true sense as an integral part of an integral component of healthcare delivery systems, and public and policy makers are not that much recognizing the pharmacists in the community. The major reason for this is the passive attitude of the pharmacists, including me. The lack of self-esteem, professional competencies are very, very important. Therefore, the IPA, Indian Pharmacy Association, most of the state branches are taking up such training program to empower pharmacists so that we can serve the public diligently and with a social respect and recognition and also translate our knowledge and skills to the public so that we can have a healthier world. And happy to know that small changes have been taking place throughout India with the help of pharmaceutical associations and from the side of the pharmacists. Let us be optimistic, take proactive role in the public health. We have to be integral part of the public health systems and change our mindset, transform ourselves, uh, being a lifelong learners and inspire others to have a global health. No doubt, the best mode to reach the public and policymakers is through patient counseling and medication counseling. That's why such a continuing education program or professional development programs are initiated by IPA so that pharmacists are empowered so that they can have a pivotal role in a patient counseling. As custodian of medicines, pharmacist has very important responsibility for the judicious use of quality medicines to the public or the people or the patient at affordable cost. Therefore, we have to be very careful so the medicine dispensed are quality medicines and they are dispensed in affordable cost also. That's also very well. I'm very happy that the HLL Amit Pharmacy are doing wonderful job of providing a very life-saving medicines in a very price and afford quality medicines. We have to be a friend in need to the public in all matters related to medicine management. We have to be the first contact person in medicine's need and medicine information. Pharmacists, that's very important role we have. And we request all the trainers to practice patient counseling and train others and give education to the public so that says society will more benefit by us. Let us stop not until the goal is reached. Good pharmacy practice is the very important for us. I take the opportunity to appreciate the management, especially the directors, vice presidents of HR, and CMD of the HLL Lifecare for taking such interest in the quality improvement of the pharma system in HLL. Dear participants, you are fortunate to be part of HLL Lifecare and serve the nation in a bigger way. Do not miss any class, as Mr. Thomas Abraham said. Interact the faculties, ask any doubts, always use your knowledge and skills to serve the public. That's a motto of our profession. On behalf of IPA Kerala State, I appreciate all the participants who showed interest to leverage their competency as well as confidence. We are thankful to, especially the executive committee of IPA is much thankful to the 25 dedicated faculty members, 15 faculty members and 10 coordinators are diligently supporting the PDP program. Once again, thank you very much for gracing the inauguration as well as the orientation program. And we are indebted to HLL Lifecare Management for entrusting IPA for this capacity building exercise of Ahmed Pharmacy. Let us work together to transform all pharmacy outlets of HLL Ahmed Pharmacy as centers of excellence in pharmaceutical care. Thanks a lot for being a part of this professional movement. Let us march ahead together for a healthier world. Be a proud pharmacist, stay blessed, and thank you, Jai Hind. Dr. Jenny?
Thank you, sir. Yeah. Thank you, sir, for those influential words. We are honored to have with us Sri Ajit N, Director, Marketing, HLL Lifecare Trivandrum, a result-driven sales and marketing professional with over 32 years of experience. He is currently serving as Director, Marketing at HLL Lifecare Limited. He also holds board positions at HITES, GAPL, and serves as trustee of HLFPPT. His expertise spans channel sales, product management, and large-scale public health initiatives under PPP and donor-funded programs, including contraceptive social marketing and diagnostic services. With a strong background in building strategic partnership with government and healthcare institutions, he has played a key role in scaling healthcare services such as Hind Labs and Amrit Pharmacies. Previously associated with Bajaj Electricals Limited, he holds an MBA in marketing, a BSc in physics honors, and certification from IIM Ranchi and IIM Kozhikode. May I cordially invite you, sir, for the formal inauguration of the program and for the inaugural address. Over to you, sir.
Thank you, ma'am. Dear Dr. P. Jayashekhar, President, Indian Pharmaceutical Association, Dr. Jose K. Thomas, former clinical pharmacist, Shri MP George, the retired former drugs controller, Shri Benny Joseph, Vice President as well as CEO GAPL, Dr. John Joseph, Professor Emeritus, Lisi College of Pharmacy, Professor Manju, Dr. Sujay Abraham, Dr. Manjula Devi, and all the other faculties, the participants, ladies and gentlemen. In fact, as mentioned by Dr. Jayashekhar as well as Sri Thomas, HLL Lifecare Limited, we have a large role to play, in the healthcare scenario in the country. We have been one of the largest PSUs in the healthcare ministry, under the healthcare ministry, the Ministry of Health and Family Welfare, right from producing of the contraception for the National Family Planning Program till entering into the services. We have been playing a major role as a 360-degree healthcare provider for the Government of India. One of our largest ventures is the RBD division, that is Retail Pharma Business Division, which has some of the major retail engagements like the Amrit pharmacies, the HLL pharmacy and surgicals. We have HLL opticals. So many of these ventures we ventured into for ensuring that we provide affordable and quality healthcare drugs to the citizens of the country. Today, Amrit Pharmacy is primarily located in most of the tertiary care institutions. When I say the government tertiary healthcare institutions, as all of the participants, as all the members attending here, they know it's the BOP, the bottom of the pyramid. The people reaching this healthcare facilities are those who are from the social economic class, maybe class 1, 2, 3. These are the categories who are actually approaching these tertiary care institutions. At HLL, we have always been striving for the quality. And when we say quality, it's not only about the medicines or not only about the diagnostics or the services that we provide, but it's all about how do we build up an institution to ensure that we encompass a 360-degree service-based, a service-based organization to the general public in the country. That is what we generally strive for doing it. As a part of organization building, when we look into Amrit, which serves more than 1 million people in a day, the footfalls that is actually happening in these tertiary care hospitals, we could actually sense a gap which was always there in terms of the delivery at the last level, the last mile. How do we address to the patient and how do we address to the patients? How do we make this as a professional body? How do we ensure that a change happens in the entire ecosystem of drug retailing? These are some of the thoughts which came, and as a result of which we have actually taken up these training programs under the continuous pharmacy education program. As all of you know, Amrit has more than 1,500 pharmacists working across the country, and to facilitate the development of these pharmacists deployed at the various pharmacy outlets, we have engaged them under the continuous pharmacy education program. This is primarily, number one, to facilitate the learning of the new developing areas of pharmaceutical science. Number two, to maintain, develop, and increase the knowledge, skills, and the professional performance of the people. And number three, it is to provide the services for the patients and the society at large, thereby building a relationship with the customers. IPA had been the professional body which has been supporting us for this program, and I'm really thankful to IPA who has really helped us to bring in this program, deliver it to the first batch of people through a 15 module program for a total 30 hours duration, which was culminated at Cochin last time, which I also attended, thereby giving the credit points to this pharmacist also. In a country like India, wherein we feel that expectation of the patients, and especially what I was talking about, the patients who are reaching the tertiary healthcare system in a government hospital or a government tertiary care, what are they actually looking at? Number one, it could be for an effective, safe, and affordable medical care. The other expectation of the customers or the patients are to dispense the drugs according to the rules and proper advice, and to advise how the medicine should be taken, what to do in case of the drugs have adverse drug reactions, etc., etc. So these are some of the expectation from the customers, and how do we ensure that we are addressing to the proper customer care? This is where the community pharmacy services are central to have a very safe and effective medicine management in terms of this advancing healthcare. Community pharmacy services, pharmacy practice will have to change in accordance with the need of this hour. And for that reason only, we are currently engaging the entire team of people for this kind of training programs. I hope the first batch who have done the programs, who are completed the programs last time, and they have been in a position to at least ensure that they have been able to deliver better than what they were earlier. And as I could also understand, as a professional body, the pharmacist who have undergone this training program, they're also having the credit points which is also constituted by the Indian by the Pharmacy Council of India under this continuous professional development modules. When I talk about transforming the pharmaceutical care centers of excellence, which is HLL's dream, what I wanted to here announce is that we are planning to implement at least 4 pharmacies across the country to be the pharma care center of excellence in this financial year itself, that is 25-26, which will be primarily focusing on solely dispensing medications to actively engaging the patient-centered care by providing comprehensive medical medication management, clinical services, patient education, and disease state management, utilizing technology to optimize patient outcomes, all the while fostering strong collaborations with other healthcare providers within the community. When I look into the first batch who has passed out, who had completed the program, I can understand this program is going to be much more important, because the people who have actually undergone the training programs would have definitely benefited from this, and that is the reason why this step we are having at least more than 90 people attending this program online to complete this online session. Each session, I'm sure, like last time, it comprises of the pre-test followed by a lecture sessions and the post-test. And I made to understand that there will be a 2-hour session on every Saturdays for a month. And the training also is meant to equip the pharmacist to practice the profession as per the pharmacy practice regulations of 2015, and thereby offering the credit points. In future, HLL plans to have 4 batches to cover around 380 pharmacists in the financial year 25-26, so that a major, at least out of over 1,500 whom we have deployed in the various pharmacies, we are having a major chunk who have undergone this particular program. Let me also underline here and mention that this pharmaceutical centers of excellence, pharmaceutical care centers of excellence, which is proposed by IPA during the last conclave to transform the Amrit pharmacies. The following activities are constantly being taken up. That is the medical dispensing to ensure the correct medication dosage and instructions are provided to the people. Medical counseling to educate the patients for the purpose of the medication, their potential side effects, drug interactions, equations, etc. The prescription verification to ensure the review of the prescription for any potential errors, contraindications, over-the-counter guidance by assisting the patients in selecting the appropriate over-the-counter medication for common ailments, health monitoring and screening by conducting health screenings for the lifestyle diseases and provide counseling based on the results, medication therapy and management, to collaborate with patients, prescribers, and other healthcare providers to optimize the medication therapy, health promotion and education by involving health promotion initiatives within the community, provide education on various health topics such as disease prevention, medication adherence, smoking cessation, etc., etc. Medication management to assist the patients in managing the medication regimens effectively. Collaborative care to collaborate with other healthcare professionals, including physicians, nurses, and specialists to ensure a comprehensive patient care. Medication safety and quality assurance by maintaining high standards of medication safety and quality. So these are some of the emphasis which IPA had emphasized during the last conclave, which we are constantly ensuring that it is delivered at the individual Amrit centers, and with 380 people planned for training in the year 25-26, I hope all these pillars would be definitely delivered at the respective Amrit centers. With this, a small message, I would like to inaugurate this second session of this continuing pharma education program, pharmacy education program, CPAP, wherein over 90 people are from Amrit pharmacies are joining for the classes. I would like to thank the entire IPA fraternity in helping HLL to ensure the delivery of the lectures, delivery of this program. And I also like to hereby tell my team of people who are from Amrit to make best use of this program to ensure that we are a professional body representing one of the largest organizations in healthcare delivery rather, and to ensure that we are on the top in terms of quality and affordable delivery of healthcare in this country. With this, I wanted to thank once again all the organizers. I would like to thank our HLL team of people, Mr. Thomas Abraham, Mr. Benny Joseph, the Vice President, who has been one of the force behind doing these training programs to ensuring so lot of quality in the whole of the processes, as well as in terms of in the organization, as well as in the business segment itself. All the organizing people from our HLL also, as well as Madam Jenny Samuel, who has been coordinating this from IPA side. With this, I would like to stop. Thank you. Thanks a lot.
Thank you, sir, for those thought-provoking words which you have given us. We are fortunate to have with us Dr. Jose K. Thomas, former clinical pharmacist at University Hospital, New York City, USA. Dr. Thomas K. Jose, presently working as a clinical pharmacist at SJ Pharmacy Corporation in Brooklyn, New York, which is a firm of his own. He was a manager of the hospital pharmacy at University Hospital, Staten Islands for 35 years. He also worked as a quality control analyst in a manufacturing firm in New York in the early 80s. He was fortunate to work both at a retail as well as hospital pharmacist setting for a long time in the US. After completing B.Pharm at College of Pharmaceutical Sciences, Government Medical College, Trivandrum in 1977, he did his M.Pharm Pharmaceutical Chemistry at University of Manipal, Mysore, India. After arriving to the US in 1980, he did his BS in pharmacy at Long Island University, New York, and did an internship at a hospital setting. Later, he completed MS in Hospital Pharmacy Administration from Arnold and Mary Schwartz College of Pharmacy, Brooklyn in 1994, and PharmD from University of Florida, Jacksonville, Florida in 2002. He got professional certification from American Hospital Pharmacy Association in diabetes and asthma management. Presently, he is member of the Pharmaceutical Society of New York and American Pharmaceutical Association. He shares his professional expertise in pharmaceutical care at conferences and workshops. It's my privilege to most cordially invite Dr. Thomas K. Jose to deliver the guest of honor address and share his insight on pharmacy practice, the US scenario. Over to you, sir.
Respected Dr. J. Shekhar and Dr. Mr. MP George, the former drug controller, they are both my classmates. Dr. Jenny Sharmal, Sri Ajit, the Director of Marketing HLL, Sri Benny Joseph, Dr. John Joseph is my junior at Manipal. Professor Manchu and Professor Dr. Manchula Devi, I met online with that Train the Teachers program, Dr. Sujay Abraham, and all the clinical pharmacists, clinical faculties, and students that has been joined. It has been my pleasure and my privilege to share something about the practice in United States, along with what is good practice pharmacy, good practice of pharmacy. Mr. Ajit has already mentioned what is good pharmacy practice. I wrote a couple of things, and he already mentioned what is good pharmacy practice. And my humble request is that if the people in India can implement at least 10% of what he has done, what he has mentioned as good pharmacy practice, we will be much better off. So, when we say there is a good pharmacy practice, it means there's a connotation that means that there is a bad pharmacy practice also. I have been given only 10 minutes, in the 10 minutes I have to cover what is good pharmacy practice. Also, I have to say what is pharmacy practice in the United States, along with what is bad pharmacy practice and what else we can do to improve the situations. Pharmacist, as you know, is one of the best professions in the United States and all over the world. Is one of the most trusted professions. People trust pharmacists as the number one person above doctors and above lawyers. Pharmacists are number one trusted professions in the world, especially in United States. He is a drug expert. He is the one who is knowledgeable about the drugs, who can give advices, who can give and direct people, and it is also important that he is also interested in the whole wellness of the patient. The rehabilitation of the people or the patient is his responsibility. So he is not only just a salesman at the counter, but he is also a responsible person who is interested in the wellness of the people, in the wellness of the patient, in the wellness of the society, and the total rehabilitation of the patient. So he should be, as Professor Dr. Jayaseka said, he should be professionally competent. How shall we be competent? Unless we is professionally competent to do what we do, what we dispense, we are nowhere. We cannot be respected in the society. I will say a short example that happened in 1 week. I am in Kerala for 1 week. Last week, I went to one of the drugstores here and asked for allergy medication for the eye. The pharmacist there on the store, she gave me ciprofloxacin eye drops. I told her this is not for allergy. And I told her, you have something else to give me for allergies. And then I told her, yeah, something. I mentioned some antihistamine or Patidine or Palatidine or Ketotifen or something like that that you can give me. And then she went and gave me something else. So that is the knowledge-wise a pharmacist in the retail store has here. That is not at all acceptable. When we say we are dispensing pharmacists, we should be professionally competent to advise and give directions to the people. Age-appropriate therapy. We should be competent to give advices to the patients age appropriate. Age appropriate means for the child, it should be a different dose. For the adults, geriatrics, for patients with multiple diseases, complicated therapy, pregnant women, it's all different categories of people. So we should be competent to know the dosing and the side effects, unrelated drug effects, all those things related to the age appropriateness. The age for a child is totally different from age for a adult, and that is different from age for a senior citizen, age for a geriatric patient. So we should be all aware. If the doctor writes something, a prescription for a dose, and if you see that it is not right for a child or a geriatric population, for an 90-year-old grandpa or grandma, you should immediately have an alert and say, this is not the right dose, my friend. You have to check with the doctor and change the dose. I am not going to dispense this. But here, that concept is not at all there. People are just going and buying medicines like chocolate or candy or grocery from the drugstores. That the total system has to be changed. Unless we have a professional outlook in our pharmacies, we will not be a professional pharmacist in the area we work. Also, when we say pregnant woman, in India, in many villages, I have seen that pregnant women and prenatal care is very, very remote, in the sense heard from some other people saying that hemoglobin 5 or 6 for a pregnant woman in a couple of villages in Andhra Pradesh is thought to be or considered to be very high. They are very happy if the hemoglobin level is 5 or 6 for a pregnant woman in Andhra Pradesh. You can imagine what is the disaster thinking of the people there. And immature death upon delivery of the mother and the child is very common in many of the villages in India. So what we have to do, prenatal care, that's an important factor that pharmacists can do. As a pharmacist, as a dispensing pharmacist, we have a big role to educate the women, educate the people, educate the child, educate the parents, educate the senior population about the dosing and about the care that they should have in proper treatment. Again, what else we have to do as a dispensing pharmacist? I have said, we have to, I will concentrate more on the retail aspect, then I will say a few things about the hospital setting. In the retail setting, what is the dispensing pharmacist can do? How many pharmacists, do you check any allergies when the patient comes with a prescription? They come and ask for a blood pressure pill or a diabetic pill or a anticoagulant or an antibiotic. How many of you asked the patient what allergies you have? Are you convenient to take these medications? Do you know how to take the medications? When you have to take this medication? When? With the meals or without meals? 1 hour before or after the meals? What are the medications you take? Do you take any Ayurvedic medications? Do you take any homeopathic medications? Do you drink alcohol? All those things are important when you dispense a medication to a patient. Unless you know what you are dispensing or what the patient is getting, we are not at all doing our role as a professional, competent healthcare professional. So you should know the allergies of the patient, know the patient what patient's medications are, especially the different medications if he has a multi-polypharmacy. So in order to avoid that, in India, we should concentrate on a single pharmacy system. Patients should not be allowed to shop around and go to different pharmacies. Rather than that, we should be allowed to concentrate on one pharmacy. When we say that in the United States, when we go and see a doctor, it is important that we have to give the name of the pharmacy where we pick up our medications. That is important. When we go to any doctor, the first thing they ask is, which is your pharmacy? So they will lead to that pharmacy, the doctor will send the prescription, not to any other pharmacy. So that pharmacist, my pharmacist, will be totally aware of what all medications I take. Doesn't matter which all doctors I see, which a dentist or a blood pressure or an endocrinologist or a gastro or a gynecologist or who, doesn't matter whoever I see, all my medications will come to only my pharmacy, and my pharmacist will be completely aware of my medications. So weekly monitoring of the blood levels, especially in hypertension, diabetes, and anticoagulants. The pharmacist has a role, and it's very important. We all have a role in monitoring the blood levels. If he is a hypertensive patient, we should be able to tell him, are you monitoring your blood pressure? Yeah, and are you taking the medications every day according to what the doctors have said? If he has said morning and evening, and morning, evening, and afternoon, are you continuously taking it? If you are taking it continuously, are you monitoring the blood pressure? Do you have a blood pressure machine at home? If you don't have a blood pressure machine at home, buy one machine which is available at a competent price so that you can tell him to buy one machine and so that he can monitor the blood pressure. Same thing with the diabetes. Are you taking the diabetes medication? Do you have a glucose meter at home? Are you continuously monitoring the glucose? Same thing with the anticoagulation medications, Coumadin or warfarin or whatever, all the anticoagulants. Especially now, patients are not a lot with stent and heart blocks. They are also on anticoagulant medications. So the anticoagulant medications also has to be monitored. It's a responsibility of the pharmacist to check and verify, are we monitoring the anticoagulations or the blood levels of the medications. So that is also another important thing. Then another thing is prescription reading. When doctors send a prescription to the pharmacy, are we able to read the handwriting of the doctors legibly? If the handwriting is very bad, if he cannot make up what he has written, immediately take up the phone and check with the doctor. Here, I think doctors have a bigger headweight. They may not be in a position to answer your telephone, but you should make a report with the doctors. Check with him, call him immediately and ask him, Doctor, do you write? I got a prescription from you for such and such a patient, but what did you write? I don't want to guess something and give something wrong, but exactly what I have written. Then again, this is the role of the patient is we have to have a profile of the patient in the pharmacy, which is totally not at all seen here, but we should develop a system whereby we should have the ability to keep up the profile of a patient. The profile contains patient's age, the allergies, the date of birth, all other medications he sees, his doctor's telephone number, which are the doctors he see. Such things he can either save in the computer. You can have a lot of programs are available now in the US and also in India. It can be developed so that you can have a software program by which you can have all the profile of the patients stored up. In that way, once you kick that patient's name or put in the patient name in the computer, all his details will come. So you will be completely aware of the things that we can do. Professionally competent. We have to be competent professionally. Unless we are competently proficient to dispense medications, we cannot do anything. Justice to what we have to do. How do we increase our proficiency in the field? We have to attend seminars and webinars and continuing education constantly. We are not at all big gods. We have to learn. Learning is a continuous process. A lot of medications come to the market every day. So in order to cope up with the new medications and the new indications, new dosing, we have to improve our continuing education. Different colleges may be able to give, our IPA may be able to give, or they may, other institutions may be able to provide a continuing education. And in US, when I say in US, we have to renew our license every 2 years. And we have to do like 30 credits of continuing education, out of which we can do half online and half must be a live continuing education whereby we increase our knowledge. That should be a important thing. So then what else we can do? As I said in the teachers program, we have to develop some drug pamphlets, which will be helpful for the common man to understand what medications are given. Because here we know nobody will read a drug insert. But if we can make a drug pamphlet, a small or few lines pamphlet indicating the dosage, the drug, the usage, drug interactions, what to monitor, when to stop it, etc. That will be much helpful for the common layman. It can be made in a common language, then the local language or in English, whichever way they can be accessible to. Then in a US scenario, when I say in the USA, things are much different. The pharmacy profession is one of the best professions in the world. Stores are huge, means like not like a store that we see off the street. It's like a 25,000 square feet store. There are a lot of different aisles in the store, meaning there is an aisle for cold medicine, aisle for cough medicine, an aisle for local antibiotics and local creams, and an aisle for suntan lotions, and aisle for feminine products. A lot of different aisles. And the pharmacy is in the back. And in the pharmacy also, if you see the pharmacy, it's not like people can crowd there. Only one patient can go and talk to a pharmacist and pick up the medicine at one time. All others have to wait. There's a waiting area in front of the pharmacy. They have to wait and until they are called. Only one pharmacist for the pharmacist to be called, and he will discuss with him all the medications, the counseling if he needs, the drug interactions, the other problems if he has, and then it will be taken like 2 3 minutes or 4 minutes, and then the next patient will be called. In the regular good pharmacy, there will be 5 different areas. There will be a drop-off area, there will be a pickup area, there will be a waiting area, there will be an area for vaccination, and there will be an area for consultation. So the 5 different areas in a good pharmacy, and that is common in almost all of the pharmacies there. Then, now in the United States, medications come through physical order and medication order entry, computerized entry. Nothing, no handwritten prescriptions are given. Prescriptions are given directly through the computer and reaches the pharmacy. In that way, all the medication errors can be avoided. Sound alike, look alike, medications are common, and those kind of errors can be avoided. Now, what else we can do here? What is bad practice? Bad practice is we should not be like a sale vendor selling groceries or fruits or something like any other salesman in the retail store in the pharmacy. Pharmacist should be professional. The attire, he should be professionally dressed. He should be professionally competent to say what he is. He should be professionally able to contact the doctor and talk to him. Doctor, this is the medications I got for this patient. Can I change it? You shall be able to change the medication to a less expensive one. If the doctor wrote for an expensive one, you can call the doctor and ask him, Doctor, can I change this to a less expensive one, which the patient can afford? You can also contribute, tell the doctor, you wrote for this patient is getting so many medications. Why don't we cut down? Because there are a lot of duplications here. He is getting the so and so medication for blood pressure, so and so for diabetes, so and so for asthma. Why don't we cut it down? Why don't we limit it to 2 or 3? Sometimes, in the United States, the doctors will agree. They will cut down certain things and they will add certain things. We can recommend for doctors if the patient is have a high cholesterol. We can recommend to include some statins into the profile. We can increase if the patient is taking some narcotics. We can suggest the doctor to include some stool softener in the profile, medications, like and so on and so forth. We can. It's a constant contact with the physician and the pharmacist. Then only we can be a professional team to improve the wellness of the people. Again, as I said in the last time, we can have seminars, we can have brown bag sessions where certain days people can bring their prescriptions and discuss with the pharmacists. What are they for? We can engage in community activities. We can be a part of the society whereby totally a pharmacist integrated into the society. And he's also a part of the total well-being of the patient. Pharmacists are highly remunerated in the United States. In India also, one our request to the big bosses is that we have to raise the remuneration for the pharmacists. We are still in a very low category of salaries in India. That's why pharmacists are not respected. If the salaries of the pharmacists are higher, they are much more, there will be much more demand and more people will come into the profession. And I think we'll have a self-respect of the pharmacists will also will increase. Even for pharmacies, I think in India, their status is much lower and not appropriate to the Western countries have it. That's all I have to say. My time is over, I think. Maybe We have to do a lot of things. We are in a journey to improve our total face. I appreciate all the 95 students who have joined the HLL team and the effort of the HLL to increase and change the face of the pharmacy in this country. I wish good luck to all the people. Try to use all the modules. The faculty is excellent. I have heard a couple of them. They are very excellent people. Take the notes, go through the notes, read, indulge in competent continuing education, and be thorough with what we do so that people will respect us when we say, this is a good for this is good for this, and this cannot be done for this. And that way we can improve the whole well-being of the society and the patient. Thank you. May God bless you.
Thank you, sir, for those insightful words which you have imparted. Next, I would like to invite an enterprising and successful personality who motivates us to think out of the box. May I invite Sri MP George, former Drugs Controller Kerala and Program Director, for a brief overview of the Professional Development Program for Pharmacists. Over to you, sir.
Respected Chair, dignitaries, and dear pharmacists. Now, as the Program Director, I have to say a lot of things to you, but now time is limited. You are already late, and you have got many more sessions also. You know, the most difficult thing is not to climb the Everest, but to change your mindset. Everybody is living with a set of beliefs, and nobody is ready to change. That's the biggest problem. If you ask anyone in India, right from the poor to the rich, the powerful to the less powerful, or the educated, non-educated, everybody, what will you do if you have got a disease, a stomach ache, or a fever, or something? The answer you get everywhere is to see a doctor or to the hospital. We can't think anything more. And it depends on two things. If you are rich, you will go to the government hospital or to a small hospital. Or if you are rich, you will go to the 5-star hospital. Again, it depends upon whether your education. If you are educated, you think and find out if you have got a stomach ache, whether I had to see the gastroenterologist, urologist, nephrologist, everything you decide. And the less educated or the uneducated will go and enter the hospital and they will send you, whom do you see that one? And the patient see the doctor, he advises laboratory tests, x-rays, or so many things, and invariably there will be drugs prescribed. Finally, the patient gets out of that one. Now the next thing, whether it is whether it's admitted or not admitted, the thing is to go to the medical store. All these areas, all the people wait patiently to see the doctor, to see the laboratory, to the anywhere. You don't have any option till you are called. But the moment you reach a medical shop or the pharmacy of a hospital, what you need is you have to get it immediately at the earliest. And you get it. The medicine. The maximum advice you get from a pharmacy or a medical shop is what is written on the cover 111101001. That's sufficient. Including you, the pharmacist. When you go to other pharmacies also doing the same thing, you never ask whether there is a pharmacist there. You never ask if there is any precautions I have to take when I take this drug, what all drugs I have to take or avoid, what all foods I have to avoid or take. Nothing, no information is asked. And here you can see medical shops everywhere, every nook and corner. But have you ever thought in the developed nations, this is not the case? If you have got a stomachache or any ordinary disease, you will require at least 1 month to get an appointment of a doctor. So they manage the disease with OTC drugs or somehow, or it will be going. That means around 50% of the diseases are cured themselves without any drugs or without any particular care. Why all these things are happening? Why? Because there are no pharmacists here. You may be working in a pharmacy where other people are also giving the medicines or selling the medicines. You don't dispense medicines here, you give only sell medicines here. India is the place where there is no pharmacy. And we are on the process of making you pharmacists. What a real pharmacist is. What in the real outside world or developed nations, what the pharmacists do. And fortunately, you are on the right path, because the first step is that in your pharmacies, your management is appointing only qualified pharmacists. You take about all other medical shops, all other pharmacies everywhere, less than 50%, less than 40%, or even not that much. There are 10 salesmen and 1 pharmacist. It's a namesake work here. And you have never bothered about the problems that it creates in the society. Around 2/3 of the drugs you sell are not for the patients. It's for the medical profession. Even without that one, your sales would have been okay. Your disease would have been created, because you don't have any role here. And we are making to change the society, to change the pharmacy profession. So the first step you are already taken. Now the second step is that when you are giving information, you are giving knowledge. I have gone through your profiles, and many of you have written that get knowledge. You have to understand that to get knowledge within this small time is not an easy thing. We can give you only some modules, but you have got the qualification to understand everything regarding the drugs what you sell. You have to know that you study much more than what a doctor study or any other person in this world study about drugs. You are the only authority of drugs. A doctor study very little thing about fundamental writing or just some pharmacology. It's not like that what you study. You are already given the education, the base level for that one. It is your trial. It is your efforts to know more. The problem in India is half of the drugs which are sold are taken not in the proper way, so that without any effect. You don't know the number of deaths, especially geriatric cases, because of our medications happening. It's all happening only because of pharmacists are lazy. I have gone through your profiles, and many of you have written that one. What's your ambition? In that one, you had that you have to be a successful person. But you don't know what is success. A success happens only when you have aims, and that aim or goal is achieved. So as a salesperson, you can never achieve as a pharmacist. You cannot never achieve as a professional gain. You will never get satisfaction in your life. You want to become a pharmacist. It's a very important role. So we will come up with that, because today there is not time. So I wish all you all the best. Thank you.
Thank you, sir, for your motivating words. Sri Benny Joseph, Vice President, Retail Business Division and Group Head, Pharma at HLL Lifecare Trivandrum, is a strategic leader driving excellence and growth in the retail and pharma sector. Sir, we are pleased to welcome you to share your thoughts with us. Over to you, sir.
Most respected Dr. P. Jaishankar sir, President, Indian Pharmaceutical Association, Kerala State Branch. Sri Ajit sir, Director Marketing, HLL Lifecare Limited. Dr. Jos K. Thomas, former clinical pharmacist, University Hospital, New York. Sri M. B. George sir, Dr. John Joseph, Professor Manju Madam, Dr. Sujay Abraham, Dr. Manjula Devi, Dr. Jenny Samuel, Sri Thomas P. Abraham, Srimati Arya, and my dear pharmacists from all parts of the country and other faculties who have assembled here for this inaugural session. A warm good afternoon to all of you. As all of you know, this year 2025-26 is a very important year for Amrit Pharmacy because this is our 10th year of operation. As many people may be knowing, we started the Amrit Pharmacy on November 2015 and hence this is the 10th year of operation. As far as HLL is concerned, in the pharmacy field, this is our 15th year of operation. And the company HLL Lifecare Limited, this is the 60th year of operation. Our Diamond Jubilee celebration is already flagged off by our Honorable CMD. So all these activities are an year-long program. In that, one of the key activity which we have suggested is from a retail business division is to provide this continual education program for the pharmacist of approximately 400 pharmacists, because last year we could able to cover around 90. So around 500 people will cover this 15 days continuous education program, which is around 25% of our current strength. So that we are hopeful that as you know, we have around 250 pharmacies as on time. So on an average, there will be 2 people in every pharmacy who got professional training from a professional body who have years of experience in this particular field and years of experience in pharma field. So as our Ajit sir clearly told, and many times our chairman Dr. Anita Thambi Madam is highlighting, we would like to see all our Amrit pharmacies and other pharmacies are to be the center of excellence. And we can make it a center of excellence only through you, only through investing on you. So you people are all maybe either D Farm, B Farm, M Farm, Farm D. You people may be qualified, not maybe, you are qualified. But continuous education, retraining, refresher training, then orientation to the goals for this particular division, mainly on patient care, compliance to the standards, good pharmacy practices, etc. are going to be the key focus areas for the current year. As you may be knowing, there are out of 2,000 people who are working with us, there are people who are excellently performing in many aspects of GPP. Like Dr. Josar has already highlighted the good practices in US and other area. Sir, in many of our pharmacies, our pharmacists are sending back the prescription to the doctor saying that there are incidents. It is not so common that, sir, this fellow and this patient is a cholesterol patient. He is having some allergic issue. He is already having some infection last year. So whether this medicine is an ideal one, they are sending it back and getting it verified. Similarly, this look-alike, sound-alike mistake is happening from our side also. But at the same time, the same thing has happened from the prescription also. There also, in many cases, I have the report from the regional manager that our pharmacists are either directly taking the matter to the hospital, to the doctor, because as we know very well here, the ego clash is very much on the higher side. Maybe discussing over phone, people may not like, but our pharmacists are taking to the doctor, going to the doctor, and just checking, sir, this is correct or not. And in many cases, genuine doctors have really appreciated our pharmacists. So this particular module on this training program, actually what we want is these kind of good pharmacy practices, the counseling practices are to be extended throughout as a part of the system. So it should not be a one in 100 incident. It should be regularly. Each and every patient who is coming to us should get at least a clarity or a counseling on how to take this medicine. Is it before food or after food, or is it on 2 times in a day or 3 times in a day, and maybe after this whether all this kind, and maybe on surgical items also we have to train in many people like maybe puffs. Sometimes we may have to train a new patient who has been prescribed puffs for the first time. So like this is the second batch. Company has really taken this initiative in a big way, and we have to do another 2 or 3 batches. And this batch, the first batch, the response was so good. Everybody was in a big way, like how you people were doing or I was doing my college time. People were very active in post-test and very active in pre-test. If they are not getting the test paper, if the things are not getting downloaded, hundreds of messages are coming in the group. Sir, this is not getting open. This is not getting open. What to do? How to do? And when the results are also getting published, they are asking questions that maybe question number 8, there are 4 choices. A and B are more closer. I put B. So, but A is the right answer, but whether B is also right. Like that, in a very, very active manner, people have really participated. And in the Cochin conclave, many people have expressed that it was very useful to them. And many of them have committed that they will practice whatever possible within the limitations of space and the crowd which we are facing in our Amrita pharmacies. They will practice this, and the regional managers are giving us the feedback that there is a good impact in the attitude of the pharmacist after those who got the training and the other training on service from her. There's a good attitude. Earlier, we used to get a lot of complaints from the ministry on our service part. Now also complaints are there, but the intensity has come down. So these training programs are really giving a positive value addition to the company, and company will definitely invest more on more and more training programs. My humble request, as Thomas told, is each and everyone has to participate in all the 15 days training program. You have to do pre-test, post-test. Any doubt, please contact. And here, as we know, each and every people are there from every state and every part of the country. This is a good forum for all of you to have a better interaction. There are good practices which is happening in maybe X pharmacy, and the pharmacist of that X pharmacy is already present in the group. You can get some idea from that pharmacy. Your good practices can be shared there. So it can be a common learning platform also. So that in all the ways, this will be a better platform. And this Indian Pharmaceutical Association is keeping the first batch totally engaged in every week by giving some new assignments, training program, some refresher program, awareness program, etc. So they are very active, and they want to see that the pharma profession in the country is getting totally transformed so that the community is getting the benefit. And as far as Amrita Pharmacy is concerned, the people who are approaching us are from the bottom of the pyramid. They don't even know the English. They may not be knowing Hindi. They may not be knowing the prescription reading. They may not heard about many of the things. So our responsibility is many fold high. So we have to see that, especially with the senior citizens, old people, or maybe a little illiterate people, which we can see when we are seeing them, we have to really tell them with good patience, sympathy, and empathy in our mind to them, so that they will take the medications in the right way, so that they will get their disease will get cured. And that is the best service which we can give to the community. The thing is that maybe whatever we are doing, the service to the community is something which is highly rewarding, and which is something will give the best mental satisfaction or personal self-satisfaction. So in this way, we got a big opportunity to save the country, to save the poor people in their needy time. So that is a very, very, very important. So I wish you all a best success and all success for this continuous pharmacy education program. Thank you very much.
Thank you, sir, for those encouraging words. Professor Dr. John Joseph has vast experience as an academician, molding young pharmacists at various colleges at different levels. May I invite Dr. John Joseph, Professor Emeritus, Lissy College of Pharmacy, Cochin, to enlighten us on the need of training for pharmacists. Over to you, sir.
Thank you, Jenny ma'am. Respected Dr. Jayashekhar and other dignitaries, faculty members, and my dear participants. It's very heartening to know that 96 pharmacists have joined this program. And I'm very happy to note that HLL has taken up this program for the uplift of pharmacists in a very serious manner. So congratulations to both. I've been asked to give a professional message, but I would rather give a layman's message. Just I'll cite one example. Dr. Josh Thomas has already given an example. Last week, a friend of mine who is an engineer, retired engineer, he knows that I am a pharmacist and I am working in a college, I'm training pharmacists, etc. So he gave me an example or gave me one of his experience. He's a diabetic person. He went to the hospital and consulted the doctor. Then he went to the pharmacy to fill the prescription. And as usual, he got his prescription filled the usual way which most of the hospitals do. They put tablets or whatever in a cover. It is printed there. One is morning, afternoon, evening, etc. All you have to do is tick the box. And again, before food, after food, etc. And this man was given the cover and he just asked the pharmacist, you have ticked the box after food, but my doctor told me to take it with food. So whether I should follow you or the doctor. And the impression he gave me was that your training is not just because that pharmacist was not able to answer my question. So he had to ask a senior person to confirm. I hope you know which drug it is to be taken, being a diabetic patient, which is the drug he has to take with. So even such a simple instruction could not be given by the pharmacist. So no wonder why our profession is not appealing to the general public. And we pharmacists lament that we are not getting any recognition, not getting enough remuneration. So my humble request to you pharmacists is to develop an attitude of service, because you are an important link in the healthcare profession between the physician and the patient. So unless and until you equip yourself lot of skill, we will be in a losing state. So develop an attitude of service, update your knowledge, and be skillful. Try to become better communicators. So this is the message I have to give you. And I'm sure that these 15 modules will take you to a level where you'll be trained to fulfill all your responsibilities. And I hope by the end of these 15 modules, you'll become better pharmacists, better service givers, and as Dr. Abdul Salam said, to help you to develop a culture of excellence, be different from others. So you yourself have to decide to what you have to do. And our profession will definitely gain by that and mass people, especially the poor, the uneducated people. Now, I'm telling you this because my friend is an educated person. That is why he asked which the one. The normal person will just take the cover and go. Maybe the box which has been ticked, they'll follow. But the kind of service we have to give totally different. And I hope at the end of this session, which you will take seriously and will definitely gain and will become better professional. Thank you very much. Wish you all the best. Thank you.
Thank you, sir, for your motivating words. Now, may I invite a streamlined professional, Mrs. Manju CS, Program Manager and Professor of Pharmacy Practice, Government Medical College, Kozhikode, for a brief description on the training modules, Zoom meeting, and attendance. Over to you, madam.
Thank you, Jerry, madam. Is it visible, madam?
Yes, madam.
Show mode.
എനിക്കത് കാണാൻ പറ്റും. Is it okay, sir?
Okay.
Warm good evening, all. Dear fellow pharmacists and all dignitaries here. Once again, warm good evening. It gives me immense pleasure to meet more than 96 fellow pharmacists from all over India coming under one umbrella. And let us hold hands together for our profession. The professional standards depends upon our professional values and attitudes, professional knowledge and understanding, and the skills. And how to enter the heart of common man. The need of the hour is good pharmacy practice. And pharmaceutical care is the backbone of good pharmacy practice. And let us zoom into pharmaceutical care with the help of the upcoming 15 modules. And today, my duty is to introduce you to Zoom. And our tools are, for this purpose, WhatsApp for our routine communication. We are already created one WhatsApp group. You all know IPA, HLL, Life Care, PDP on good pharmacy practice. This is our WhatsApp group. Then we are using Zoom Cloud for meeting and classes. And another one is Google Classroom. This is a virtual classroom for posting our assignments, study materials, pre-test and post-test. Google Forms for collecting data, answers or opinions. And today we will discuss about Zoom. Zoom Cloud Meetings, it is commonly shortened to Zoom. It is a video teleconferencing software program developed by Zoom Video Communications. And this is compatible with the Windows, Mac operating system, iOS, Android, Chrome operating system, and Linux. And today we'll discuss about installing, how to install. Many of are familiar with this Zoom. Then how to install Zoom in our computer or iPhone or Android phone. Then some etiquette. Then how to join a meeting, facilities in this Zoom, and leaving a meeting. So first about how to install Zoom in laptop. I request the participants to use laptops for better experience. Mobile phone, it will be a small screen, and we may not understand many of the diagrams or things we are discussing in the classes, upcoming classes. So it is better to use laptop. So installing Zoom in the laptop, just Google, type zoom.us, Zoom client for, then select the Zoom client for meeting, download it, then go to your downloads in the laptop, then right click on the downloaded app, click on run as administrator, and then we'll be able to install Zoom in your laptop. And if it is a mobile phone, just go to Play Store or App Store, search for Zoom Cloud Meeting, install Zoom. Then for joining a meeting, today we all joined in the meeting. For joining a meeting, no need to take account in Zoom. Only thing needed is installing the app. For joining, we can join a meeting by two methods. One is using the given meeting ID and password. The other one is through the link provided. There is a message came from IPA in the WhatsApp group that stating this is, for example, this is the link, meeting Zoom link, and below that there is meeting ID 24696322156 and passcode, capital letters IPA PPF is given. So we can join by two methods, using this link or through this meeting ID and passcode. So using the meeting ID and passcode, this is a mobile screen or laptop screen. Here we can see the Zoom installed app. Then just click on that app. Now we will see meet and chat. So there are so many options. New meeting, we can create new meeting. We can join a meeting. We can schedule a meeting for later use. We can share screen. And this is the, while join a meeting, the meeting ID, we can provide the meeting ID here. Then join. Joining a meeting through the link provided. Click on the invitation link or message. You can click this message or link, then select, then it will show like this, Zoom. Then we can select Zoom and preparing meeting. Connecting will be shown. It will show a message like that, preparing for meeting. Then it will connect to that meeting. Then coming, next is the facilities in Zoom. I already mentioned that we can schedule meeting, we can join, we can join a new meeting or already scheduled meeting, and we can share screens. And below that, we can meet and chat. You can send some messages. Now also you can send. Then settings is there. First go to settings in the Zoom. Then there is auto connect to audio. We can off or on that. Always mute my microphone. It will be helpful for us to on that message, on that option. Always mute my microphone. Then if we are entering into a Zoom meeting, all noises will be prevented. And always turn off my video. We can make it on. In such condition, we will be, when we enter into a meeting, our microphone and video will be muted. So see like this is start, the video is muted. If we want to unmute, we can click on that. And there are many some other options also. We can send some emojis or raise hand. If we want to say something or ask to some doubt, we ask to ask some doubt, we can raise hand. Raise your hand option and change your background option is there. In a meeting, if you are keeping our video on and if the background is not looking good, we can change that to a virtual background. Then next is the etiquette in entering into a meeting. First one is the identity. While joining the Zoom, it will ask what is the name you prefer to. And in our program, in IPA HLL PDP program, all the participants will be provided with a register number. There are 96 participants, so 1 to 96 may be like that. You will be provided with a number. Then while entering into or while setting the Zoom, you should give your name and that register number. For example, if your name is Geedu PN and your given number is 21, then you can give Geedu PN 21. That will be better for your identity. And we can see many participants joined Vivo, then Realme, Zoom user like that. Kindly avoid that. Please reveal your identity, your name and the given number. Then always mute the microphone. If you want to talk something, then you can unmute and talk, and otherwise should mute. The camera must be turned off or on, depends upon the situation, and the background you can change. And we can also unmute the microphone if you want to talk. And again, join early in the morning, or not morning, early in the meeting. And you can see a message that is given by Jaishankar sir in the group. Kindly join 5 minutes before. So join early and dress appropriately. If you are talking something with the video on, dress appropriately and aware of the surroundings, avoid too much of noise. Then mute microphone when not talking. Stay seated and stay present always. Minimize distractions and give grace to our presence. Then what are the rights of the participant or guest in Zoom? We cannot control the meeting. The meeting is controlled by the host. We can mute our video or audio or quit. We can unmute the microphone muted by the host. If you are making too much of noise, sometimes the host will unmute all. Then if we want to unmute, we can do that. And host can mute the microphone of all the participants and cannot unmute the muted. The host cannot unmute the muted participants, or that depends. And now we can, if you want to exit or leave from the meeting, we can click on the leave option, and or otherwise the meeting is end by the host. And it is better to use the laptop, and please be attentive in the virtual class, and better to keep the video on. And next is about our modules. We are having 15 modules. Our first module will be on 10/5/2025. It's about good pharmacy practice and pharmacy practice regulation 2015. And it will be done by Dr. Ramesh Adappu. The next class, all the classes are scheduled on Saturdays, 3 to 5 p.m., all Saturdays. Next class, rational use of medicines and good practice and patient safety by Dr. Pradeep M.R. Communication skills of pharmacist and non-prescription medication by Dr. Jenny Samuel. Scientific dispensing practice and prescription audit by Dr. Shamna M.S. Drug laws and storage conditions of medicines by Dr. Maniveena. Bioavailability and drug interactions by Dr. David Paul. Counseling of medications of diabetes mellitus by myself. Asthma management, Dr. Suja Abraham. Medication of cardiovascular disease and hypertension, Dr. C.B. Joseph. Anti-infective drugs and antimicrobial resistance, Dr. Kiran S.S. Hormonal medications including contraception and female health disorders, Dr. Ramya Gayatri. Safe use of medicine in pediatric and geriatric population, Dr. L. Panayappan. Medication of NSAIDs and gastrointestinal disorders, Dr. Linu Mohan. Patient safety and pharmacovigilance, Dr. Narmada MP. Medical devices and surgicals, Dr. Manjula Devi AS. And as per the schedule, it will be ended, all the 15 modules will complete by 16/8/2025. Then about the attendance and CPD points, there are 15 modules and 15 CPD points. Participants should be present for the entire duration of class. Minimum 60 minutes is in a module. That depends upon the situation. It will be counted for attendance. There is minimum number of attendance for getting certificate, and participant attended 15 modules will get 15 CPD points. That's all about Zoom and our modules and attendance. Thank you all. Best wishes.
Thank you, madam, for those words of information about the Zoom. Next, may I request a dedicated and inspirational pharma professional, Dr. Suja Abraham, Program Manager, Professor and HOD, Nirmala College of Pharmacy, Muvachupura, to provide a brief overview of using Google Classroom and attendance requirement for the program. Over to you, Madam.
Thank you, Jenny ma'am. So, respected dignitaries from IPA HLL and HLL Lifecare Private Limited and IPA Kerala State Branch, dear participants and faculty members. So, today I'll be briefing about the Google Classroom and assessment methods. So, I'll just share my slide. So, Jenny ma'am, can you make me that co-host? Not able to share the slide.
One second. Now it's okay?
Ma'am?
Yeah. It's visible now.
So, Google Classroom, I think you might have joined in the Google Classroom. So, there is not much introduction about that, but still I'll just explain. So, when we open the Google, you can see 9 dots in the right upper corner. So, in that, when you click on this 9 icon, you can see one classroom here. So, directly when you click on this icon, you can go to the classroom where you can see the link and all the details of the classroom in that area. Otherwise, if that is not working or if you're not able to join in that classroom, there will be asking some class code and you can type the class code in this area. So that I'll just share you. So this is the class code of IPA HLL Lifecare PDP second batch. So GEZJ2IRB, all are in small letters. So this code you have to type it in this area so that directly the link will be open to you. So this is the classroom specifically for this batch and all the communications will be there in this classroom. So you can see there will be 4 main icons here: stream, classwork, people and grades. So stream is the main area where all the announcements will be there, or like all the communications regarding the classrooms, regarding the schedule of the program, and then some pre-test, post-test, the assessment methods. Then after the class, we'll be posting the slides that can be accessed through this classroom. So all the informations related to the classes can be visible through this classroom. And then you can see the classwork. So in classwork, when we are giving any type of test or assignments, that will be visible in this area. So this is the one which we have given in the last given for the last batch. So after each module, we will be giving the pre-test just before the starting of the classes, and then we'll be posting the slides, and after the test, we'll be posting the post-test questionnaires also. And the third one is related to the people. So here, teachers as well as students, these two are the criteria. So all the faculty members will be there in the teachers category. And the students or the participants will be in this students category. So this is also visible to each one of you. And finally, you can see the grades also after each presentations or after each classes, you can see your grades as well. So this is about the Google Classroom. So since you might have joined in this classroom, you can see all this up to this point, you can see all the materials in the Google Classroom. And next we can see the assessment methods. So like we discussed in the previous episodes, there will be pre and post test. So pre-test means we would like to know what you know about the particular topic. So if you are taking any topics related to hormones or related drugs, before the class, we will be giving a pre-test. That is a simple recollecting type of questions. Only 5 questions will be there. So within 5 minutes, we can submit the pre-test. And then after the class, we'll be giving the post-test. So which is about 10 questions, and that will be somewhat elaborated, maybe case-based. Some examples will be there. So that type of questions will be in the post-test. And even after each presentations, one evaluation questionnaires also will be circulated to you. So this evaluation means how you can rate the presentation so that So this is the pre and post test. And here also, you can see like this, the questions will be there. Some Google Sheets will be given in the pre-test. Just 5 questions only will be there. Each one carries 1 point. So 5 points will be there for each, for the pre-test. And in that, we'll be asking the name of the participants and questions will be there. Options also like this. And at the end, you can just click on the submit button. So this is about the pre-test. So same way, post-test also will be there. Post-test, as I mentioned, it will be like little bit higher order and some example-based or case-based questions will be there. So only after attending the classes or after going through the slides only, you can answer post-test types of questions. So in a nutshell, pre-test, 5 simple MCQs of equal questions to be answered in 5 minutes. Usually this will be posted at 3 p.m. So if it is the class is at 3 means by 2:55 or 3 p.m. the pre-test will be posted and immediately you need to submit within 5 minutes. And these questions you can receive in the Google form through your email or through the classroom. So after submission, you will get the grades instantly. Post-test, it is of 30 minutes duration, only 10 questions, but as I mentioned, it will be little higher order. And this will be posted at 9 p.m. on the day of each class and submit the answers before 9:30 p.m. on the same day. So all the module delivery will be evaluated by the participants using Google Classroom at 9 p.m. on the day of class. And this will help us to improve ourselves for the next session. So that's about the Google Classroom as well as the assessment method. So if you have any doubt, you can ask. I think there is no question. So over to you, Jenny ma'am.
Thank you, madam, for that informative session. Next, may I request a committed and motivated pharma professional, Dr. Manjula Devi, Program Manager, Professor Sri Ramakrishna Institute of Paramedical Sciences, Coimbatore, to give a brief overview about the criteria for CPD points and merit certificate for the program. Over to you, madam.
Thank you, ma'am. Am I audible?
Yes, madam.
Is the slides visible, ma'am?
Yes, madam.
Okay. So warm good evening, most respected and distinguished guests of this program, faculty members, and dearmost participants. Just now, Suja ma'am has introduced all the test criteria, and let us look or revisit the topic once again so that it will be, if you have any doubts, you can clarify it. So I'll be telling you about criteria for CPD points and merit certificate. So in here, I would tell you only 4 aspects. What criteria we are using to assess the participants, how the participants are being assessed, and what does 1 CPD point means, and what is the maximum CPD point one can earn during the program, and how to get the merit certificate. So these are the 4 points we will be looking into it. So first, let us see the assessment criteria. That means how the participants are being assessed during this program. It is, as just now Suja madam mentioned, you will be having a pre-test and post-test. Pre-test will be posted at 3 p.m. and post-test will be posted at 9 p.m. Pre-test will carry 5 MCQs and post-test will carry 10 MCQs. Pre-test is for 5 marks and post-test is for 10 marks. So totally it is for 15 marks. And the duration for pre-test is 5 minutes. Within 5 minutes, you have to submit the answers. And post-test has to be submitted within 30 minutes. 9 p.m. if we are receiving. Before 9:30 p.m., you have to submit the answers. Pre-test will be very simple. The purpose of conducting pre-test is to know the pre-acquired knowledge based on that topic. And after attending the course, you will be having the post-test. The questions will be of higher difficulty level. That means the questions will be based upon critical thinking, case-based or problem-based type, and it can be an open book type. You can use the slides or the class session material, whichever you have attended, and you can answer, but it will be a little more complicated questions for which you have to attend the session and then answer the question. And both the pre-test and post-test, as Madam mentioned, it will come to you in a Google form. Attendance is also mandatory throughout the session. So good net connectivity is mandatory throughout the class session. Very good net connectivity is mandatory. So that is also accountable for your CPD point. So what is a CPD point? One CPD point. Before that, what is CPD point? It is CPD means continuing professional development. CPD means continuing professional development, and the CPD point which you are earning in each class indicates the quality of your CPD activities. So what is one CPD point? How can you earn one CPD point? As Madam mentioned, there is totally 15 CPD point because you have 15 classes. So one CPD point will be earned after attending one class. So one CPD point will be earned with 2 hours of participation. Throughout the class, you have to participate, and it should be an interactive session. You should be very interactive. Throughout the class, you should be interactive whenever required by the staff. And attendance of assessment. So these two will be considered to give you or to get one CPD point. 2 hours of participation in a class plus your attendance in the pre-test and post-test. So these 3 are mandatory to earn one CPD point. Your pre-test, post-test, and 2 hours of attendance in the class. These 3 are necessary to earn one CPD point. So like this, how many CPD point we can earn? Totally 15 classes. So 15 CPD points. Now coming to the best performers. So best performers are decided based upon the score. We know in each class, you have a pre-test and post-test. Total score is 15. So based upon the total score, best performers are decided. So we already know that the maximum score that can be obtained in each class is 10 plus 5, that is post-test plus pre-test, 15. This is the maximum score. So in every class, we will know the best performer. The best performer of every class. The list will be posted in the next day itself. So if you attend the class attend properly and do the pre-test and post-test and score good mark, naturally your name will come in the best performer of that class. So like this, you have 15 classes. So maximum score that can be obtained at the end of the full program is 15 into 15. So 225. The total score is out of 225. And your score obtained in each class will be added together to find out how much you have scored. Based upon that, we will find out the best performers. At last, 5 best performers will be awarded certificate of merit and trophy on the basis of your performance in the class. So what is the criteria to become the best performer? Your regular attendance, then total grades in the pre-test and post-test, plus your active participation in the class. So regular attendance, total grades in the pre-test and post-test, active participation in the class. What is meant by active participation? Whenever necessary, wherever you are allowed, you can ask queries to the teacher and you can ask doubts in the chat box. And when you are encouraged, you can share your experience based upon the topic. So you have to be an active participant. This is the expectation throughout the session. So like this, best performers are selected. And at last, you are also getting an opportunity to evaluate the module delivery by the faculty. You can evaluate the faculty's module delivery, for which we will be sending you a feedback form. You can complete it and submit it within 5 minutes. So that's all about the criteria for CPD points and merit certificates. Wish you all the very best for successful completion of this program. Thank you. Thank you for this opportunity. If you have any doubts, you can ask.
Thank you, Manjula Madam. As Manjula Madam just mentioned, now is the time for any queries which the participants have, and we will be happy to take them. Madam, can you stop slide share? Manjula Madam?
Yes.
If anybody is having any question, you can ask now or put it in the chat box.
If you get any doubts, you can post it in the WhatsApp group also.
Minimum, can you check the chat box? Some messages are coming in the chat box.
Sir, it's regarding duration of classes. Normally, class will be for 1.5 hours to 2 hours.
2 hours, 2 hours.
Yes, yes. You can feel free to ask your doubts.
I think we can go to the next.
Thank you.
Yeah. I think we can go to the next session, isn't it?
Ma'am, there is one question. There is one question whether
Yeah,
any notes will be given in each class.
Yes, no, yeah.
I think the PPT will be supplied. PPT will be uploaded in the Google Classroom.
Google Classroom.
The
yes,
same
right.
day. The same day. Any other questions?
Next class onwards, you should be interactive always. We will be monitoring who all people are interacting. This shows your learning level. I think no more questions are there. We can proceed further, ma'am.
Yeah.
Yes.
Yes, sir. Thank you, Manjula madam. There is nothing more precious in the world than gratitude. May I request Ms. Arya Krishnan, Assistant Manager HR at HLL Lifecare Trivandrum, who is a dedicated HR professional committed to fostering a positive and supportive workplace environment, to deliver the vote of thanks. Over to you, madam.
Thank you, ma'am. Good afternoon. It was a great evening altogether. It's both an honor and privilege to deliver the vote of thanks on this special occasion, the inauguration of the second batch of our professional development program, in continuation with the successful completion of the first batch as a part of our continuous pharmacy education program, initiated by the Retail Business Division of HLL Lifecare Limited. And I'd like to thank the Indian Pharmaceutical Association, Kerala State Branch, for associating with HLL Lifecare Limited. And my sincere thanks to the great leadership of the IPA Kerala State Branch, Dr. Jayashekhar, President IPA Kerala State Branch, Shri MP George Sir, Program Director, Dr. John Joseph, Secretary IPA Kerala State Branch, Dr. R.N. Gupta, National President IPA, Dr. Ramesh Gupta, National Vice President IPA. Your support plays a crucial role in shaping the quality and impact of this program. Now, I'd like to extend our heartfelt gratitude to our Director Marketing, Shri Ajit N, for gracing us with his presence and sharing such inspiring words. Your insights have truly added immense value to this program's inauguration. Thank you, sir, for your constant support and guidance. Next, I'd like to thank Dr. Jose K. Thomas, former clinical pharmacist, University Hospital, New York City, USA. Sir, we are really honored to have you today as our guest of honor. Thank you for sharing your experience about the pharmacy practice in US scenario. Shri Benny Joseph, Vice President, Retail Business Division and Group Head Pharma. Sir, without you being in this position, we cannot imagine our division in these heights. Thank you, sir, for your encouragement and guidance. I'm grateful for your message on today about the good pharmacy practice. Thank you, sir. Thank you, Shri Thomas P. Abraham, Deputy Vice President HR, for your welcome note. And your eagerness to learn and grow is what makes this initiative meaningful. Thank you, sir. A sincere thanks to the expert team of faculties handling the sessions on various topics on good pharmacy practice. Thank you, Dr. Jenny Samuel, ma'am, Professor Manju CS, Dr. Suja Abraham, Dr. Manjula Devi, who made today's program enriching. We are expecting the same and even more in this batch also. Thank you for your committing your time and expertise. Last but not least, I'd like to thank all our participants nominated for this second batch. As Ajit sir and Benny sir told, make use of this great learning opportunity for enhancing your professional skills. Let's move forward with enthusiasm and shared commitment to professional excellence. Wishing you all a great learning ahead. Thank you all.
Thank you, madam. We have come to the close of this inaugural ceremony of PDP for pharmacists. Let's all rise for the national anthem.
पंजाब सिंध विधाता जय हे जय हे जय 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 हे
Thank you all once again for being with us and best wishes for a successful program ahead.
Thank you.